CNA's Wei Du sat down with Hong Kong Secretary Sophia in an exclusive interview and asked her about the government's thinking behind the mass testing program.
People who are psychologically bothered, for example, that they are not confirmed cases, but then they actually live in a building whereby it's very close to another building where there are outbreaks, then they would be able to get a test when we have a larger capacity that can actually cover people in Hong Kong if they want to test.
This is about helping people sleep at night.
This is not only trying to help people, to ease people's mind in terms of whether they want a test, but there is also public health significance, because if we know that from our testing results of our high-risk groups and also testing results from our community, our existing testing that we found, from the results show that there is still silent transmission chains in the community. So I think further ramping up testing, in a larger scale would definitely, help in finding out more of these cases.
Talk to me about the scale of this testing program, because it's voluntary.
Yes, it is voluntary.
How many people do you think will sign up?
Well, I think this is a free service provided to people in Hong Kong. If they want to, go for a test, it is made available, for them. It is very difficult to sort of assess, whether people would like to, go for this test.
I read in the press previously you said 5 million, but that's not a target.
Well, that is not a target. That is, we want to make available the capacity for people who are coming to test. Yeah. So obviously, our laboratory capacity we have to take into consideration.
What does that entail in terms of manpower?
In terms of manpower, you mean the laboratory testing manpower?
Or a swapping station, all the people that you're going to need to run this program.
Yes, that is going to be quite a big number of the swabbers. For people who will be taking these tests for the public. We need healthcare professionals, so we are now recruiting.
How many do you need?
Well, I think we need thousands of them.
Okay.
Yes, and
you've recruited how many?
Yeah, we have been recruiting. The recruitment is still in process.
Okay. After this mass testing is done and supposedly silent transmission is rooted out, is that it? There won't be another wave?
Well, there probably will be another wave if you look at the international situation. Before we have an effective vaccine, we always have to live with the virus. So not only testing is important, but we are building our capacity, for example, in contact tracing, our hospital capacity, and also continue our stringent border measures. I think those are important prevention and control measures that we have to continue.
For more on how Hong Kong is battling a third wave of coronavirus infections, tune in to Talking Point next Thursday at 9:30 p.m. on MediaCorp's Channel 5. You can also watch it next Friday at 9:30 p.m. on CNA.